My name is Gunter Van Loon from Ghent University, and I just gave a talk on feed-related cardiac disease. And actually the purpose of my talk was to create awareness that certain cardiac diseases may originate from the food or from things that horses have ingested. And the problem is that diagnosis making is not always that easy. Very often these cases are only detected in a rather late state where treatment becomes more difficult. So we want to create awareness so that people think about this possibility and make a diagnosis earlier in the disease process. Very often the clinical signs are not very specific. Horses may, however, present increased heart rates, which occurs in many disease states, but they may present cardiac arrhythmias, and that's a very important finding. If you have horses in a bad general condition and they also have cardiac arrhythmias, these should be checked by ECG to know which kind of arrhythmia is present. Secondly, we will often check with ultrasound to see if there is an abnormal cardiac contractile function, because this can also lead to a specific disease process or the diagnosis of this kind of a process. Very easy in clinical practice is to take a blood sample, because that is very, very helpful to detect whether cardiac damage is present or not. If you want to analyze the blood for cardiac damage, you should check cardiac troponin I or cardiac troponin T. So we no longer measure LDH isoenzymes, even CKMB, which was also thought to be a good cardiac marker, is definitely very inferior to cardiac troponin measurements. So very easy measurement and very helpful to detect cardiac disease due to ingestion of abnormal things, for instance, due to intoxication. The most important sources of intoxication are ionophores, and ionophores are due to accidental contamination by feed from poultry or feed from cattle that contain these ionophores like monensin, salinomycin and lesoleucid. On the other hand, we also have important plant intoxications, plants that contain cardiac glycosides, and most people know foxglove, and they also know yew, so taxus. But there are many plants that contain cardiac glycosides, and we should be aware of that, and we should really check for these plants in the pasture or in the environment of the horse. It might be helpful to check the blood for digitoxin or digoxin, because usually we can find low levels of these products in the blood when horses are contaminated or when they are poisoned by cardiac glycosides. The reason we can find low levels of digoxin and digitoxin is that there is cross-reactivity with the cardiac glycosides, and usually we can find only low levels of digoxin and digitoxin, but still it indicates that poisoning has occurred. So in conclusion, just be aware that certain cardiac disease may result from ingestion of toxic compounds. We should try to make an early diagnosis so that we have an early treatment to get the best results. Thank you.